One question could save your life, and most people never ask it. High blood pressure often has no symptoms until it's dangerously high. That's why it's called the silent killer. But here's the truth, simply taking medication isn't enough. If you're not asking your doctor the right questions, you might be missing the chance to prevent serious complications. In this video, we'll uncover the top 5 questions you must ask your doctor about hypertension, and why each one matters more than you think. These questions will help you understand the root of your condition, avoid unnecessary medications, and take control of your long-term health. Because managing blood pressure isn't just about numbers, it's about being informed, prepared, and proactive. Let's dive into the first essential question you should never leave your doctor's office without asking. Question 1. What's causing my high blood pressure? Before you can fix a problem, you need to understand what's causing it, and high blood pressure is no exception. Too often, doctors prescribe medication without helping patients understand why their blood pressure is high in the first place. But knowing the cause is the first step toward treating it effectively, sometimes even reversing it. Why this question matters. High blood pressure isn't a one-size-fits-all condition. It can be triggered by a wide range of factors, some obvious, some hidden. Asking your doctor what's causing your high blood pressure helps tailor your treatment plan and avoid unnecessary medications. There are two main types of hypertension: primary, essential hypertension. This is the most common type, and it tends to develop gradually over time due to genetics, aging, or poor lifestyle habits. Secondary hypertension. This is caused by an underlying condition such as kidney disease, sleep apnea, thyroid issues, or even certain medications like decongestants or birth control pills. If your doctor isn't ruling out secondary causes, you could be treating the symptom, not the source. What your doctor should consider. Here's what your doctor should explore when you ask this question. Your medical history. Do you have diabetes, kidney disease, thyroid imbalance, or a history of heart issues? These conditions can directly raise blood pressure. Medications you're taking. Some over-the-counter and prescription drugs like NSAIDs, steroids, antidepressants, or hormonal treatments can raise blood pressure as a side effect. Family history. If high blood pressure runs in your family, your doctor may classify it as primary hypertension, but that still doesn't mean it's untreatable. Lifestyle factors. Smoking, drinking, lack of exercise, stress, poor sleep, or a high sodium diet can all spike your numbers. Your doctor should ask about your habits and environment. Testing for underlying causes. If you're younger than 40 and have high blood pressure, or if it's suddenly spiking with no explanation, your doctor should consider tests for secondary causes like kidney function tests, hormone levels, or a sleep study for sleep apnea. Red flags to watch for. If your doctor simply says, "It just happens with age," and writes a prescription without further evaluation, that's a red flag. Good doctors take the time to investigate. They don't just treat, they aim to understand. What you can say in the appointment. Here are some phrases you can use when asking this question. Could my blood pressure be caused by something reversible, like a medication or underlying issue? Do you think I might have secondary hypertension? Can we look into possible causes before starting or adjusting medication? These questions signal that you're an active participant in your health, not just a passive patient. Why it's empowering. When you understand what's behind your high blood pressure, you can often take specific steps to fix it, without relying solely on lifelong medication. For example, if poor sleep is the cause, improving your sleep hygiene or treating sleep apnea can lower your blood pressure naturally. If your kidneys aren't functioning properly, targeted treatment could bring your numbers back to normal. If a medication you're already taking is raising your BP, switching to a different one might solve the problem. But none of this happens unless you ask the right question. Next up, let's move on to question 2. Question 2. Do I really need medication right now? Just because your blood pressure is high today doesn't mean you need to start medication tomorrow. It's one of the most misunderstood parts of hypertension treatment, the rush to prescribe pills without fully exploring lifestyle changes, temporary stressors, or natural solutions. But here's the truth. Not everyone with high blood pressure needs medication right away. And if you do need it, knowing why and for how long is just as important. Why this question is crucial. Medication can be life-saving, but it can also be overprescribed. Asking your doctor, do I really need to start medication now, or are there other options, opens the door to a more thoughtful, personalized approach. It ensures you're not starting a lifelong prescription based on one or two elevated readings alone. It also forces the conversation about severity, urgency, and alternatives. How doctors decide if you need medication. Your doctor will typically look at several factors before recommending medication. How high is your blood pressure? A reading consistently over 140 over 90 millimeters of mercury is considered hypertensive. Over 180 over 120 millimeters of mercury is considered a hypertensive crisis and may need emergency care. If you're in the 130 to 139 over 80 to 89 range, you may be in the elevated or stage 1 zone, often manageable without drugs. Do you have other risk factors? Diabetes, kidney disease, heart disease or prior stroke, smoking or obesity, high cholesterol? If so, your doctor may lean more toward medication to reduce cardiovascular risk. Are your readings consistent? One high reading doesn't mean you have hypertension. Doctors usually want to see multiple elevated readings, especially at home, not just in a clinic where white coat syndrome can spike your numbers. Have you tried lifestyle changes yet? If not, your doctor may give you 3 to 6 months to lower your BP naturally before prescribing medication, unless it's dangerously high. How to ask this question. Here are some clear and respectful ways to bring it up. If my blood pressure is borderline, can I try diet and exercise first before starting medication? Is this something I could reverse with lifestyle changes? How long would I need to stay on the medication if I start now? These questions show that you're engaged and open, but cautious about jumping into pills. What the research says. According to the American Heart Association and major guidelines, lifestyle modification is the first-line recommendation for many patients, especially in stage 1 hypertension without other risk factors. In fact, simple changes like reducing sodium, increasing potassium-rich foods, losing 5 to 10 pounds, quitting smoking, or managing stress can lower blood pressure just as much as a single medication in many cases. That said, if your blood pressure is dangerously high or you're at high cardiovascular risk, medication may be necessary immediately. This question is about clarity, not refusal. Medication isn't bad, but it's a big step. Blood pressure meds are incredibly helpful and often life-saving, but they can also come with side effects like fatigue, dizziness, headaches, erectile dysfunction, cough or swelling, depending on the type. So the decision to start meds should always come after a thoughtful discussion. It's your right to understand why the medication is being prescribed, what the goal is, and what the long-term plan looks like, especially if you want to try getting off meds later with lifestyle improvements. Don't be afraid to ask, do I really need this, or do I have other options? It doesn't make you difficult, it makes you smart. Your doctor's job is to inform and guide, not dictate. The more you understand the why behind your treatment, the more successful you'll be at managing your blood pressure long-term. Next up, let's move to question 3. Question 3. What lifestyle changes would help me the most? Not all lifestyle changes are created equal, so which ones actually move the needle on blood pressure? You've probably heard generic advice like eat better or exercise more. But when it comes to hypertension, your time and effort should go toward the changes that deliver real, measurable impact. That's why this question is key. What lifestyle changes would help me the most? You want your doctor to personalize the advice, not just hand you a pamphlet. Why this question is a game changer. Everyone's high blood pressure has different root causes: diet, stress, weight, genetics, sleep, medication, side effects, or a mix of several. A cookie-cutter approach doesn't cut it. By asking this question, you're pushing your doctor to think about your unique situation and help you focus on what will give you the biggest return for your effort. This is especially helpful if you're newly diagnosed and overwhelmed. You want to avoid or reduce medication. You've tried lifestyle changes before with little success. Doctor-approved lifestyle changes that really work. When you ask this question, Here are some of the most common and most effective strategies your doctor might recommend based on your profile. 1. Reduce sodium intake. The American Heart Association recommends limiting sodium to 1,500 to 2,300 milligrams per day. High salt intake can retain fluid, raise blood pressure, and burden your kidneys. Processed foods, canned soups, breads, and sauces are major hidden culprits. Pro tip: ask your doctor if you're salt sensitive. Some people are more affected by sodium than others. 2. Increase potassium-rich foods. Potassium helps relax blood vessels and balance sodium. Top sources: bananas, avocados, spinach, beans, sweet potatoes, and yogurt. If you have kidney problems, though, your doctor might caution you about potassium levels. Another reason to personalize. 3. Lose excess weight. Even 5 to 10 pounds helps. Blood pressure often drops 1 millimeter of mercury per kilogram of weight lost. Belly fat especially is linked to insulin resistance and inflammation, both of which raise BP. Your doctor might recommend starting with small, manageable changes like walking daily or cutting sugary drinks. 4. Get active but safely. Aerobic exercise like walking, cycling, swimming, or dancing can drop your systolic BP by 5 to 8 millimeters of mercury. Aim for at least 30 minutes a day, most days of the week. But if you have other conditions like heart problems or arthritis, your doctor can suggest safe modifications. 5. Limit alcohol and quit smoking. More than 1 to 2 drinks per day can raise blood pressure. Smoking causes blood vessels to constrict and damages the lining of your arteries. Ask your doctor if these are contributing factors in your case and how to taper safely if needed. 6. Improve sleep quality. Poor sleep or undiagnosed sleep apnea can significantly raise blood pressure. Your doctor might recommend a sleep study if you snore, feel tired during the day, or wake up frequently. 7. Manage stress effectively. Chronic stress can raise cortisol and adrenaline, keeping your BP elevated. Breathing exercises, meditation, and even therapy can play a powerful role. Ask your doctor what stress management strategies are proven to work and which ones are worth your time. What you can ask in the appointment. Here's how you can frame this question. Based on my health and lifestyle, which 1 to 2 changes should I focus on first? What lifestyle changes do you see making the biggest impact in your patients? Can we create a step-by-step plan I can stick to? You don't need to overhaul your entire life overnight, but small, consistent steps tailored to you can make a huge difference. When you ask, what lifestyle changes would help me the most? You're no longer blindly following general advice. You're targeting the root causes of your blood pressure and putting your energy where it matters. This one question could save you years of frustration and possibly even help you reduce or eliminate the need for medication. Next, let's move to question 4. Question 4, how often should I monitor my blood pressure? You can't fix what you don't track. And when it comes to blood pressure, timing and accuracy matter more than you think. Many people rely solely on their doctor's office readings, but that only shows a snapshot, not the full picture. Monitoring your blood pressure at home can give you more control, detect problems early, and even avoid unnecessary medication changes. But the key question is, how often should you check your BP? Why this question matters. Blood pressure fluctuates throughout the day. It rises when you're stressed, falls when you sleep, and can even spike after coffee or exercise. That's why depending on a single reading at the clinic, especially if you're nervous, can be misleading. When you ask your doctor how often to monitor, you're making sure you're not overchecking and causing anxiety. You're not underchecking and missing silent spikes. You're getting reliable data to guide treatment decisions. General guidelines for monitoring. Here's what most doctors recommend based on your situation. If you're newly diagnosed or starting medication, check twice daily, once in the morning before medication and once in the evening. Do this for 5 to 7 days straight before your next appointment. Record your readings and bring them to your doctor. This helps establish a baseline and lets your doctor see how your blood pressure behaves outside the clinic. If your blood pressure is stable, 2 to 3 times a week is often enough. Focus on consistent conditions, same time of day, seated calmly, using the same arm and device. This avoids unnecessary stress and still keeps you informed. If you're making lifestyle changes, once daily is helpful to track progress, especially after changes in diet, exercise, or sleep habits. Ask your doctor what target range you should be aiming for. Tips for accurate home monitoring. To get reliable numbers, follow these doctor-approved tips. Sit calmly for 5 minutes before measuring. Rest your arm on a table at heart level. Don't talk or move while measuring. Take 2 to 3 readings 1 minute apart and average them. Avoid caffeine, smoking, or exercise for 30 minutes beforehand. Also, make sure you're using a validated automatic upper arm cuff. Wrist or finger monitors are often inaccurate. What to ask your doctor? Use these sample questions. How often should I check my blood pressure at home based on my current status? What numbers should I be watching for, and what's considered a warning sign? Can I share my home readings with you during checkups? Your doctor may even recommend keeping a blood pressure log or using a digital app to track trends. Why it's empowering. Home monitoring gives you real-time feedback. You'll start to see how food, stress, sleep, and movement affect your blood pressure, and that awareness alone helps you make better choices. And when you're armed with consistent, accurate readings, your doctor can make smarter treatment decisions without relying solely on one office visit. Next up, let's go to question 5. Question 5. What are the signs that my blood pressure is out of control? High blood pressure doesn't always scream, it whispers. And if you don't know what to listen for, you could miss the warning signs until it's too late. That's why this question is so important. How will I know if my blood pressure is dangerously high? Because waiting for obvious symptoms is risky. By the time you feel something, serious damage may already be happening. Why this question could save your life. High blood pressure is often called the silent killer for a reason. Most people don't feel any symptoms until it's reached a life-threatening level. Asking your doctor what you should watch for, based on your current readings and medical history, can help you catch problems early and take action fast. And while many people assume headaches or dizziness are always linked to high BP, the reality is more complex. Common signs of poorly controlled or dangerous blood pressure. Here are symptoms that could indicate your blood pressure is out of control, but keep in mind they're not always present. Sudden, severe headaches, especially if they come out of nowhere and feel different from past headaches. This could signal a hypertensive crisis. Chest pain or tightness. This could mean the heart is under extreme pressure and isn't getting enough oxygen, a medical emergency. Blurred vision or vision changes. High BP can damage the blood vessels in your eyes, leading to vision disturbances or even vision loss. Dizziness or loss of balance. This may signal that blood flow to the brain is impaired, especially dangerous in older adults. Shortness of breath could indicate fluid buildup in the lungs due to heart strain from prolonged high blood pressure. Nausea or vomiting with neurological symptoms. If combined with confusion, slurred speech, or difficulty walking, this may point to stroke. What is a hypertensive crisis? A hypertensive crisis happens when your BP spikes above 180 over 120 millimeters of mercury. It can be urgent, high BP but no signs of organ damage, may be treated at home with meds. Emergency, high BP with chest pain, confusion, or blurred vision requires immediate ER care. Ask your doctor how to respond if your home readings ever hit dangerous numbers and when to call 911. What you can ask your doctor. Make your questions specific and personal. Try, are there any symptoms I should never ignore with my blood pressure? What should I do if I feel dizzy or get a severe headache? What's the danger zone for my readings? And when should I seek help? Your doctor may also guide you on what symptoms are not related to blood pressure, so you don't panic over every ache or twinge. Why it's empowering. Understanding the warning signs, even if rare, helps you stay alert without being anxious. It also builds confidence in managing your condition on your own. The goal isn't to scare you, it's to prepare you. With the right knowledge, you can act early, respond wisely, and protect your health before problems spiral out of control. Next up, let's wrap this up with a powerful conclusion and call to action, because asking questions is just the beginning. Managing high blood pressure isn't just about numbers. It's about asking the right questions before it's too late. If you've made it this far, you already know that taking an active role in your health can change everything. These 5 questions aren't just conversation starters, they're lifesavers. These questions turn you from a passive patient into an informed partner in your care, and that can lead to better outcomes, fewer medications, and a longer, healthier life. So the next time you sit across from your doctor, don't hold back. Ask with confidence, ask with clarity, and most importantly, ask like your life depends on it, because it just might. Now it's your turn. If you found this video helpful, share it with a friend or family member who needs to hear it. Hit the like button, subscribe for more doctor-backed health content, and let us know in the comments what question are you going to ask your doctor next. Stay informed, stay empowered, and we'll see you in the next one.